the last time I went to Dr. Bratland's to get my teeth cleaned, and yes, I live in Montana, and I go all the way to Eugene, Oregon to get my teeth cleaned because they have my records. They are the staff that I like, and I don't want to find another dentist. So, but Dr. Lauren Cuda came in to do a check on me and to make sure everything was. Tell people, what is that you do, and why do you do that?
So every 6 months, sometimes it's once a year, patients are due to have periodic exams by their dentist. We just are making sure to see if anything has changed in your dental history, your medical history. If you have any concerns that day, we're able to address them. We want to make sure that we're doing our due diligence of getting a look at least once a year of what's going on intraorally. For us, we also take our x-rays then, and as a general dentist, you should be able to give your patients a good picture of what's going on during that appointment every 6 months or a year. And that includes also what I believe you really liked was your head and neck exam, which I get that a lot, that patients really enjoy having the head and neck exam portion of the checkup. It's basically a screening from the top of the head to the sternum for any signs of extraoral cancer. We also look intraorally at the tissues to see if there's any signs or potential issues with inside the mouth cancers.
So is it surprising to people, do you think, or would be, how much a dentist can really, like, you're the first line of, you can really find some things that the doctor, we may not go to the doctor for, but since we're in there, dental exams really do find what? I mean, that's...
Mm-hmm. Most definitely. I think that a lot of people sometimes forget that they often see their dentist more than they see their primary care physician, in the sense that if you are doing your due diligence going to the dentist, it's usually every 6 months at least. So you're here with us sometimes more than you are with your primary care provider. With that being said, also, I know that medical doctors, they do the utmost job as well, checking things at your appointment. However, I know that they do not have as much training intraorally as we do, and sometimes don't always know what to look for. So it's exactly what you said. Sometimes we're the first people who recognize something going on intraorally, and then we do our job to decide if there's something where that needs to be, referred to someone else, maybe back to their primary care physician. But yes, that happens quite often. And I think the patients are also pretty shocked by it as well. A lot of times I get a comment of, oh, I've never had a dentist do that before. I've never had a dentist give me a head and neck exam and check for these types of things. So
and you can also, aren't we learning more dental wise that a lot of diseases in your body can start from gums and oral things going on in your mouth if you're not taking care of your teeth or your gums or that kind of thing? That can cause other kinds of illnesses. Is that true?
So I don't want to make any big claims, but I know that they're related. There's a lot of research that shows that patients who have periodontal disease also have other diseases that affect systemically. One may not cause the other, but they're usually very much related. And patients also who have periodontal disease, a lot of times, or different types of things that we see in the mouth, are more likely a lot of times to be affected with other systemic diseases.
So what do you love about what you do?
I grew up probably the dentist's worst nightmare. I had everything imaginable done in my mouth that you can think of. Probably, when I was younger, I had cavities on my baby teeth, and I had fillings there. I also was born congenitally missing 12 teeth, and so what that meant for me was that I had a lot of spacing in my mouth, and so I was my orthodontist's hardest case, he told me, and I was in braces for almost 7 years. with the end result really not being the most ideal situation. I still had a lot of spacing in my teeth. My teeth were also very small, as that's something that's seen with people who are born missing teeth. And after that, I had treatment with dental implants. I had treatment with crowns to try to basically give myself a full mouth rehabilitation. So in that sense, I feel that there was no way I wouldn't have been influenced to join the dental career as I was growing up, because I was always there. And I really appreciated when I was there how much of an impact it really made on me, both mentally and emotionally. I remember when my case was done, I cried to my general dentist. I couldn't believe what I had been through and what I was looking at in the mirror. So I knew that was something that I really wanted to pursue. I also really, really, really liked the idea that dentistry is something where you can really get to know your patient in a positive way, I hope, because I know a lot of people talk about how they have terrible experiences with dentists. And I really liked almost giving myself that career path because I know I'm really good with people. And also being able to make them feel really comfortable with such a vulnerable place. Because I know a lot of people just really, really, really dislike the dentist. You'd be surprised how much we hear that too, is, oh, I hate being here. Oh, I hate the dentist.
But you were so kind when I went in, and and I think that's what impressed me about you too, is, Dr. Bratland and the staff there, and you fit right in, but you were really, and and I think you being through all that, I had a dentist one time, and when he'd work on you, he'd open his mouth, he was like my age at the time, he had molar fillings everywhere, and I always felt like, oh, good, he knows what I'm going through, so even more what people could go through because you're the worst case scenario.
Yes.
You know what I mean?
Yes.
So there's no judgment when somebody comes in and says, I haven't been here for 3 years. You're like, well, then let's start today.
Exactly. And I always tell patients that when they come to the clinic with that sort of mindset, I just say the biggest leap you just made was getting here. And that's something that you should honestly be very proud about, because I know that it is very, very difficult to face the different, dental treatments, dental fear that come with not seeing us. So it's totally fine with me when I see patients and they're like, you don't want to look in my mouth. It's a train wreck. And I say, you don't know what a train wreck is. So,
so why Crisdental?
My husband and I, we are from Texas, and we've been together for over 10 years. And we always wanted to move somewhere where there was a potential for more outdoor activities, more outdoor living. And not that Texas isn't great. It's wonderful. I'm not bashing on Texas, but that was just something that from a very young age, as we are high school sweethearts, my husband and I.
Oh, wow.
Yes, we knew that was really, we wanted to go somewhere that just was completely different from where we were. And with my position we were living in Houston, and with my position in Houston, it wasn't going to be a forever situation. So we just started looking, and we honestly got so lucky with being able to come here to Eugene, Oregon, because we would have never imagined that this would have been as beautiful and also such a welcoming clinic as well. So I came up and I interviewed with Dr. Bratland a couple months prior to joining the clinic officially. And I knew right away that this clinic was run differently, in a good way too, very organized. There was a role for every person in the clinic, which makes the job of the dentist just that much more easier, and not to say that our jobs are easy, but you always love to have the help and just the team that really, really knows how to run a dental clinic.
Well, that lets you do what you got to do because
Mhm.
you got your hands in the mouths of people,
Mhm.
and so if people are handing you instruments and people are right there next to you,
Mhm.
that's when it works like teamwork. That's what I never feel like I'm wasting my time when I'm there. You know what I mean? I've been to other clinics where it feels like hello. It's like, and I feel like, man, it's moving here. You know what I mean?
Yeah,
You're in, you're moving, and it's not rushed, but it's like it's not dragging out too, because you don't want to be there longer than you have to be.
exactly. Yes, and I think that with dentistry, you're always going to run into different obstacles. And I'm not perfect, and I wouldn't say Dr. Bratland is perfect either. And we always try, though, to do our best. And that was something that Dr. Bratland and I really we meshed well with, was that we try our best to be as upfront and honest with patients. We don't sugarcoat it.
Right.
And we tell them, hey, this might take me a little bit longer than expected, or hey, this might be something that goes over a little bit of time, or we're going to get you out the door right away. And we always want to be as truthful as we can. We don't want anything to be behind some sort of curtain, because just like I said earlier, you're so vulnerable at the dentist a lot of times, I feel. And it's, to me, really important that patients know that I am aware of that. And I don't want you to have any sort of belief that I'm dissuading you in some direction that isn't what I would think is the best thing for you. It isn't what I wouldn't do in my mother's mouth, my father's mouth, my siblings' mouths. So,
Well, Dr. Bratland is the king of crowns, I like to call him. I mean, he is so efficient because I've had it done somewhere else, and he's so efficient about getting things done. Because that's a long procedure, and you don't want to be there. I mean, you already have everybody's. It seems like the whole clinic's hands are in your mouth, and you got tubes hanging out, and
yes.
things going in and grinding and noises,
Hmm.
and man, it's like fat. It's get it done, and he does great work. So,
He does.
well, so where did you go to school?
I went to school in Texas. I grew up in San Antonio, and I was fortunate enough actually to get into dental school in San Antonio, so in-state tuition, great. And then I did a advanced training residency program in Houston. Working a lot in the hospital, taking calls, seeing emergency cases, and then also working in the operating room with patients who are severely medically compromised, giving them the dental care that they otherwise wouldn't be able to receive in a normal clinical setting.
So, Lauren, thank you so much for coming on and just talking a little bit about who you are and what you do. And like I said, I was really impressed. And I've been going to the dentist for a lot of years. And I feel like I'm kind of like you. I didn't have to go through what you went through, but I had teeth that were up here. They pulled, moved over here. And I mean, so much stuff going on in your mouth, but your mouth is really important. And I think, I have people all the time go, how come your teeth are so white? And it's like, because I take care of them.
Mhm.
And it really is part of kind of your introduction to the world. You know
Mhm.
what I mean? When you see people, and I think taking care of that, I think is really important.